Tonight, there's a doctor dilemma across the tri-state.
A new study just released finds Greater Cincinnati has a shortage of almost 200 primary care doctors. 9 on Your Side reporter Jay Warren live now with the sobering news. Jay?
Well, that's right, and it looks like the problem will continue to grow to 250 by the year 2017 as the Affordable Care Act takes full effect. You see, as more people become eligible for coverage, the number of doctors is not rising with the number of patients. It was at least 2009 when we started talking about the projected shortage of primary care doctors. Then Dr. Jeff Sussman of UC Physicians explained young med students were headed for the larger paychecks of specialization.
We're looking at expansion of class sizes, but ironically, the numbers going into primary care are actually going down.
Almost 4 years later, the picture looks worse, says Dr. Robin Chapman, president of the Academy of Medicine of Cincinnati. She conducted the Health Collaborative study.
The study told us that we have some issues. We don't have enough primary care physicians, and in the areas where we even had the largest numbers, the distribution of those physicians was not optimal.
Which is to say that Hamilton County comes close to having enough primary care docs, but in places like over the Rhine, for example, there aren't enough to meet the demands of the population.
We've got to find a way to train more primary care physicians. We've got to find a way to make primary care more attractive to medical students. And we've got to find a way to address the costs of a medical education so that students are more inclined to go into primary care.
She says one answer is to pay the debts of students who want to become primary care docs.
I think we need to reward those students who say, this is where the need is, this is where I'm going to work. And then to those students we say, okay, for every year you work in this underserved area, we're going to pay off your loans for this year.
Now, there are efforts to attract more people to primary care. For example, UC's medical school offers a primary care clerkship, which allows a first-year medical student to shadow a primary care physician in the community to learn more about it. Jay Warren, 9 on Your Side, Mount Adams.